Yesterday, Ohio Governor Mike DeWine announced during a press conference that in 2023, for the second year in a row, unintentional drug overdose deaths in the state were down. However, there are still some struggles and data to look at. And coinciding with yesterday's press conference was the release of this report, a few pages long, and I combed through it, got the highlighter out, and just to bring you an idea of what in general continues to be the big issue. We're going to first start out with a look at this chart, which gives you a great idea of what the issue at hand is. It's fentanyl, and it is much more common a substance than those other substances you see on this graph. But you will notice that while fentanyl is starting to lose some ground, cocaine is starting to gain some ground, and that is becoming a concern, and it's going to be mentioned again in this report, so stay tuned for that. Another part of this report mentions drug combinations, and in deaths caused by cocaine, the majority of the time it's being mixed with fentanyl. But with regard to fentanyl deaths, heroin has been the most common mixture. Another key part of this report was demographics, which health officials look at so they can get a better idea of where their efforts are reaching and not reaching. Hispanics in the state have the lowest amount of unintentional overdose deaths per 100,000 people, though that number did increase by about 8%. In terms of most impacted by unintentional drug overdose deaths, it's black males followed by white males, and those numbers are starting to come down, though white males, those numbers are starting to come down at a faster rate. Another part of this report looked at age, and what it found was that white non-Hispanic males and females, for that group, the 35 to 44 age bracket was most impacted, while black non-Hispanic males and females, the age bracket was 55 to 64 being most impacted. And at the end of the report, there was a look at the geography of this situation, and it showed that Appalachian, Ohio has some of the highest death rates in the state, with Scioto County having the highest at 130.1 per 100,000 people. Reporting in Toledo, I'm Jaden Jefferson.